Ready.
What I'm going to demonstrate today is I'm going to demonstrate a wet to dry dressing, sterile dressing, and this is what's going to be required for you on your laboratory exam, okay? So what you need to do this particular procedure is you need a forceps, you need a Curl-X fluff. It has 2 fluffs in it. You're going to wet one, and then you're going to use that to clean, and then you're going to pack with the other one. Then you're going to need 2 4x4s that go over the wet dressing in the wound, and then you're going to cover it with a combi pad or ABD pad on the outside. You're going to need a roll of tape. You're going to need some sodium chloride, and this is my little garbage bag where I'm going to put my really contaminated trash in. I've fan folded it and stuck it here away from my sterile field. All right. If the patient needs medication prior to, you would medicate them. And remember that the purpose of the wet to dry dressing is what? Debridement, right? So you want to do that for that particular reason, and also for open wounds, right? This is a wound that is healing by secondary intention. Now what I'm going to do is I'm going to take off the dressing, the outer dressing, okay? And the outer dressing is contaminated. The inner wound you cannot take off with clean gloves because it's inside of the patient body. We're gonna need to use sterile instruments. So what I'm doing is I'm taking off the old dressing, okay? And I'm noticing that there seems to be some purulent material. So I would have to get a culture for that, okay? I'm going to take this contaminated dressing and put it inside of the bag. And I'm going to just observe. My gloves are very contaminated now because I've touched some purulent drainage. So I'm going to take them off, and I'm going to place them inside of my contaminated bag. I'm going to wash my hands before I do this sterile procedure, okay? And now the next part of this is that you need to open up all of your sterile packages. The last piece after you've prepared everything is you're going to put on your sterile gloves and work with the wound, okay? When you're opening up sterile packages, you need to open away from you, not over the field. What I would recommend with all of these particular packages is that first of all, just kind of loosen up the adhesive. Seat it with your hand that's, for me, it's left. I'm going to open with my right away from me. And if you grab the package at the middle part or the center of it, you just pull it back and let it drop. The next package I'm going to open is my Curl-X fluffs, 1 to pack, 1 to clean. I'm going to ease away the adhesive and pull it straight back in the center of the package. My next dressing that I'm going to utilize is going to be my 4x4s. And what I'm going to do here is I'm going to pull this package again straight back. The combi pad can be placed on at the end because the outer aspect of this dressing is in contact with the environment, okay? Now, before I put my gloves on, because again, clean touches clean, sterile touches sterile, I need to wet my Curl-X fluffs. I'm always going to take this sterile, inside sterile, outside's clean. I'm going to take the cover off with the inside facing upward. I'm going to pour directly, not over my field, directly over where I need to pour the liquid, okay? And then what I'm going to do is I'm going to take this and put it back here. Now what I can do is excuse me, I can put my sterile gloves on. I'm going to open up my sterile gloves, pull the gloves out. When you're putting sterile gloves on again, you're going to take the top flap, crimp it down. You're going to take the flap closest to you, crimp it down. You're going to go underneath the edge, 1-inch edge, okay, and make sure this lays nice and flat. The only part of the sterile gloves that you can touch are the cuff closest to you. The fingers are sterile. Pull it up from your field, put it on. Then you're going to take and put your next glove on, hang on to your paper to secure it, thumb out like you're hitchhiking. Okay, then you can fix, stay away from your cuffs. Now what I'm going to do next is I'm going to take that packing out of the inside of his body, which is considered sterile, even though there's drainage on it. Take your forceps, and you want to make sure to really hyperextend, right? What we're kind of doing here is really keeping our wrist up so that it doesn't contaminate. Okay? Keep your hand in front of you so you see it at all times. I'm going to take out the inner packing, and I'm going to drop it into my bag. Make sure your forceps doesn't touch that bag. Keep it high. Drop high. Then I'm going to place this again with an exaggerated wrist movement back on the center of my field. Then what I'm going to do is I'm going to take this top 4x4, fluff I should say, and I'm going to wring it out. I'm going to use this to clean. So what I'm going to do is I'm going to quarter this, okay? And in real life I'd use 3 sponges, but the way I'm doing it now is the way we want you to replicate. I'm going to again pick up my sterile forceps, and I'm going to always keep my hand in front of my face so I can see it. I'm going to go down the inner incision from the top to the bottom, and I would throw this out. I'd have a new one, and I'm going to go away from me, top to bottom, and then towards me, top to bottom. Okay? I'm going to empty this out into my bag, dropping high. I'm going to place this back down. I'm going to wring out my gauze here, my fluff, that I'm going to pack this with. In order to maintain good circulation, you need to loosely pack this. In order to do that, you kind of have to open it up. So what I'm doing is I'm opening up this gauze, and I'm going to put it in my left hand and wick the end. I'm going to grab my forceps. I don't want my fingers to touch the wound, all right? And the forceps going to pack this. Okay, so I'm going to pack the wound with my forceps. Okay. Then I'm going to take and put this down. Now, the next 2 dressings I use with kind of a pincher method. I'm going to drop one down, then the other. Now, in essence, I'm clean. Now I'm clean, correct? Everything is covered. So now what I'm going to do is I'm going to open up my ABD, outer ABD pad, and I'm only going to handle this on the blue line. I'm going to use a pincher method. The next thing I'm going to do is I'm going to place tape to secure it. Always make a little tab on the end of your tape so that when you're taking off, and again, I'm not contaminating the tape or anything else in the atmosphere because I haven't touched the wound. I'm going to place this down, one at the top. You always go with the flow of the normal anatomy. And then I'm going to place one in the middle. Cheated myself. Let me put a longer one. Tab on that end. Don't push on the center, push on the side to keep it secure. Make sure that you date, time, and initial it and put it on the wound. Before you take care of all of your equipment, you need to put, patients come first. So you're going to put your binder back on. Remember that the securement of the binder goes away, not on top of the wound. You're going to get your patient situated. Remember that your clean trash, okay, because this stuff's not contaminated, correct? Can go here. Oui? Okay. But this is pretty contaminated, right? So what I want one of you to do for me, which I didn't do, I want you to cuff this bag for me. Can you cuff this bag for me? And what I'm going to do, I cuff a bag and I put it right down here. I don't want to touch this if at all possible because it has a lot of purulent material. So what I'm going to do is drop it in this way, okay? Because that needs to go to the clean utility room, or dirty utility room, I'm sorry, and get dropped in a solution. It's a great big red container, okay? So that it can get disinfected and sent back down and re-sterilized. This is going to go in my contaminated bag. I'm going to take off my gloves and I'm going to handle the bag underneath the cup because the inside's contaminated. I'm going to drop this in the trash, which kind of does a double bagging technique. And then I'm going to place my patient in a safe position with the call bell in place, okay, and the bed down in low position.